Ever wake up and feel your knees arguing with the rest of your body? Left unchecked, that daily ache can quietly steal your balance, freedom, and even your favorite Sunday stroll. Yet, a 2018 US study found that seniors who massaged aching joints with lavender oil cut pain by nearly a third. Imagine reclaiming that walk. Ready to learn how a few fragrant drops can help? Let's break it down.
1. The hidden cost of ignored pain. Most of us shrug off a twinge in the knee or stiff lower back, but ignoring those signals can snowball into bigger problems faster than you think. First comes mobility loss. Every painful step shortens the next one, and researchers found that seniors who walk slowly face double the fall risk of their brisk striding peers. Next comes sleep disruption. Nighttime aches nibble away at deep sleep cycles, so you wake up foggy, irritable, and more likely to reach for that cup of coffee. Layer in the emotional toll. Chronic discomfort triples the rate of depression in adults over 65, eroding motivation to stay active or socialize. Finally, the medication cascade. Relying on daily NSAIDs might ease pain now, but long-term overuse is tied to ulcers and kidney strain, surprises no Medicare plan fully covers. Unchecked for years, joints stiffen, posture falters, and climbing porch steps can feel like Everest. Leave the cycle in place and independence can fade into assisted care. The silver lining? Many of these dominoes can be stopped, even reversed, with a science-backed routine you can start at home today. It all starts with understanding which oils do what for sore cells.
2. A layered essential oil protocol for lasting relief. To start turning the tide on muscle and joint pain, we'll build a simple 3-layer essential oil routine that you can do at home, step by step. First, lay the foundation with a warm towel primer. Heat a clean washcloth in water warmed to about 105 degrees Fahrenheit, warm enough to soothe, not scald. Then add 2 drops of eucalyptus oil. Wrap this fragrant compress around the sore joint for 3 minutes. The gentle heat opens pores, improves circulation, and carries that eucalyptus goodness deeper into stiff tissues. Always perform a quick patch test on your forearm, diluting your oil at about 1% strength, roughly 5 drops per ounce of carrier oil, to make sure your skin agrees before massaging more sensitive areas. Next comes step 1, pain relief massage, which targets overloaded nerve endings so they quiet down. In a small dish, combine 2 drops of lavender oil and 2 drops of peppermint oil with 1 ounce of jojoba or almond oil. The lavender calms inflammation at the cellular level, while peppermint's mild menthol provides a refreshing, cooling distraction from discomfort. Using gentle circular motions, massage the blend into the affected area for about 5 minutes twice a day, morning and evening. This balanced approach applies pressure to tense muscles, encourages extra blood flow, and sends a calming signal to overactive nerves. Remember, never rub on broken skin or apply undiluted essential oils. Wash your hands well afterward to avoid unintentional eye contact. Step 2. Anti-inflammatory compress focuses on stubborn swelling that can lock your joints in place. Fill a bowl with warm water, not hot, and stir in 3 drops of ginger essential oil plus 2 drops of frankincense. Soak a clean gauze pad or thin towel in this aromatic mix, wring it gently, and drape it over the joint for 10 minutes after any physical activity, such as walking or light stretching. Ginger's warming compounds help reduce swelling by acting on inflammatory markers, while frankincense supports cellular repair deep in the tissue. If you ever feel an uncomfortable burning, remove the compress immediately and rinse the skin with plain water. As evening falls, step 3. Night diffusion primes your body for rest and repair. Pour 4 drops of Roman chamomile oil into a bedside diffuser or vaporizer filled with water and run it for about 30 minutes before bedtime. This creates a calming atmosphere that gently lowers stress hormones and invites deeper, more restorative sleep, giving aching muscles and joints the downtime they need to recover. Be sure to clean your diffuser's reservoir regularly to prevent mold growth and follow the manufacturer's instructions for safe operation. Finally, adopt a monitoring and adjustment mindset to tailor this protocol to your personal response. Keep a simple diary each morning, noting your pain level on a 0 to 10 scale, any changes in sleep quality, and how many steps you managed the previous day. After 2 weeks, review your entries. If your pain score has dropped by at least 1 point and your walking distance has improved, continue as is or gradually reduce the frequency of compresses. If your pain stays above a 6 for more than 3 consecutive days, consider increasing massage sessions to 3 times a day or consulting a healthcare professional for further evaluation. The goal is always apply sparingly, monitor, adjust, so you get maximum relief without overdoing it. By following these layers, foundation, massage, compress, diffusion, and mindful tracking, you interrupt the cycle of pain and inflammation, rebuild circulation, and promote cellular healing. This structured, science-backed routine puts you back in the driver's seat of your own health, letting you move more freely and enjoy the simple pleasures like gardening, dancing with grandkids, or a peaceful Sunday stroll that make everyday life richer. 3. Flexible alternatives and supportive boosts. If you ever find that peppermint's minty chill feels too intense on tender skin, or you're missing a bottle of ginger oil, don't worry. There are smart swaps and helpful add-ons to keep your routine flexible and effective. Equivalent alternatives. For that cooling, pain-blunting effect, swap peppermint with spearmint oil. Spearmint delivers a gentler menthol sensation that's perfect for sensitive joints or thinner skin. If frankincense or ginger isn't on your shelf, consider a CO2-extracted turmeric oil. It mimics ginger's anti-inflammatory action without a strong, spicy aroma, making it easier for those with scent sensitivities. And when lavender's floral note isn't available, clary sage steps in as a calming substitute. Just avoid it if you have naturally low blood pressure, as its gentle hypotensive properties could make you feel lightheaded. Equivalent alternatives could be, for a cooling, pain-blunting effect, swap peppermint with spearmint oil. Spearmint delivers a gentler menthol sensation that's perfect for sensitive joints or thinner skin. If frankincense or ginger isn't on your shelf, consider a CO2-extracted turmeric oil. It mimics ginger's anti-inflammatory action without a strong, spicy aroma, making it easier for those with scent sensitivities. And when lavender's floral note isn't available, clary sage steps in as a calming substitute. Just avoid it if you have naturally low blood pressure, as its gentle hypotensive properties could make you feel lightheaded. Additional support options. Beyond essential oils, small lifestyle tweaks can amplify relief. A magnesium-rich Epsom salt soak, half a cup of salts plus 3 drops of rosemary oil in warm water, relaxes muscles and primes skin for deeper oil absorption. If you miss the hands-on massage component, follow a short, chair-based Thai-style stretch video. These gentle movements open joint spaces and help oils penetrate more deeply when applied immediately afterward. When choosing substitutes, keep a few criteria in mind. Consider fragrance tolerance. If you have allergies or breathing issues, stick to unscented carrier oils and introduce new scents one at a time. Think about cost. CO2 extracts and organic options can be pricier, so reserve them for areas that need extra care. Factor in personal health conditions. Those prone to low blood sugar may prefer spearmint over peppermint,
And anyone taking blood thinners should limit ginger or turmeric concentrations. With these alternatives and add-ons, you can customize your pain relief toolkit without compromising safety or results. Whether it's a milder cooling agent or a gentle stretch that makes the oils more effective, these options ensure no one is left out of feeling better. Before we talk about the precautions every senior should know, let's make sure you're selecting the best fit for your body and budget.
4. Safety first. Contraindications and quality checks. Even though essential oils are natural, they aren't risk-free, especially for seniors managing other health issues. Always check with your doctor before adding oils to your routine, particularly if you have chronic conditions or take prescription medications. First, be cautious if you're on blood thinners such as warfarin or aspirin. Oils like ginger and frankincense can amplify anticoagulant effects, raising bleeding risk. If you have a history of seizures or epilepsy, steer clear of high senile oils, eucalyptus or rosemary, unless your neurologist gives the green light. Those with moderate to severe kidney disease should avoid excessive topical NSAID alternatives. Overloading on certain oils can strain already compromised kidneys. Stop using any oil at once and seek medical advice if you experience burning redness, an itchy rash, sudden dizziness, or trouble breathing. Never apply more than 10 drops of essential oil to a single joint in one day. For diffusion, limit sessions to no more than 60 minutes within a 24-hour period to prevent respiratory irritation or headaches. Always dilute your chosen oil to around 1% strength, about 5 drops per ounce of carrier oil, and avoid contact with eyes or mucous membranes. Quality matters. Look for oils that have been GC-MS tested, gas chromatography, mass spectrometry, to verify purity. Choose U.S.-based suppliers who provide batch numbers and certificate of analysis, and buy in dark glass bottles to protect against light degradation. A little extra cost here can safeguard your health and ensure you're getting real, potent oil instead of a synthetic or adulterated product. Now that you know which conditions require caution, how to spot warning signs, and where to find top-quality oils, let's move on to Section 6 and explore the simple, senior-friendly indicators that show when your routine is truly making a difference. 5. Tracking progress. Improvement indicators. Tracking your progress. After 2 weeks of the essential oil routine, you'll want to know whether it's really working. Let's break this down into subjective signs, how you feel, and objective signs, what you can measure, along with rough time frames to guide you. In week 1 to 2, pay attention to your morning stiffness. You might notice it takes you less time to straighten up after sitting. Perhaps the ache in your knee eases enough that you can stand without leaning on the countertop. That's a subjective sign of early progress. Objectively, track your pain on a simple 0 to 10 scale each morning, and log how far you walk in your favorite loop or around the block. Even an extra 100 to 200 feet is a win at this stage. By month 1, deeper improvements should appear. You may find yourself sleeping more soundly, waking fewer times to adjust sore joints. Emotionally, you might feel less grumpy morning person and more ready to seize the day. On the numbers side, notice if you're reaching for NSAIDs fewer than 3 times per week versus daily before. If your pain score drops by 2 points or more compared to week 1, that's a clear green light to keep going. At month 3, look for more confidence in everyday tasks. Climbing stairs without hesitation, bending to tie a shoe without wincing, or carrying groceries upstairs with steadier balance. Subjectively, these victories feel like reclaiming independence. Objectively, you might time yourself on a timed up-and-go test. Stand from a seated position, walk 10 feet, turn, and sit back down. An improvement of 2 seconds or more is significant. To stay organized, keep a simple diary. Date, which oils you used, dosage, pain score, sleep quality, and notes on any side effects. Reviewing this once a week helps you spot trends. If your pain scale stays above 6 for more than 3 days in a row, or if swelling persists despite compresses, it's time to escalate care, either by tweaking oil blends, increasing massage frequency, or consulting your healthcare provider. By regularly checking these indicators, early stiffness relief, better sleep, reduced pill use, and improved mobility, you'll know precisely when to dial up, dial back, or celebrate your progress. This keeps you motivated and ensures your routine adapts to your body's needs. Before we start the conclusion, I want everyone to comment below your symptoms or the type of disease you're concerned about. I will reply to the comments or in the next video so everyone knows how to handle it. I will help you have good health to be happy with the people you love. Don't forget to like and share with your friends to know more about this important knowledge.
6. Takeaway and mantra. Rub, relax, regain. As a quick recap, chronic pain can stealthily erode your balance, sleep, and mood. But a science-backed essential oil routine interrupts that cycle naturally. Beginning with a warm eucalyptus compress, followed by a lavender peppermint massage, an anti-inflammatory ginger wrap, and a soothing chamomile diffusion, you're layering relief and supporting healing. Mindful tracking and safety checks ensure you apply each step effectively and avoid side effects. After all, you deserve to move freely and enjoy time with loved ones. The takeaway is simple. Small daily drops can rebuild big daily moves. Keep your routine consistent, listen to your body, and celebrate every improvement. And remember the mantra: rub, relax, regain.